Limited wrist extension. The muscles that actually perform wrist extension and that you should focus on if the client has weakness or pain when that motion is resisted are the extensor carpi radialis longus, the extensor carpi radialis brevis, extensor carpi ulnaris, and extensor digitorum. The muscles that restrict wrist extension and that you should focus on if the client has limited extension during a range of motion test are the flexor carpi radialis, flexor carpi ulnaris, palmaris longus, and also the muscles that flex the fingers, which are the flexor digitorum superficialis and profundus. So if you haven't done an evaluation standing, one of the things you can actually do is a wrist evaluation with the client on the table. And if you take the arms up like so, you can bring both the wrists into extension and feel the end range, or flexion and feel the end range. So if you have a restriction in extension on one side, we're going to place the arm on the table out at a 45 degree, enough so that the hand comes off the table, and apply static pressure into the forearm with your fist. And you can use the outside hand or you can use the inside hand. And you can use your knuckles like so, or you could use your palm. And if you're using other modalities, you could do Swedish massage, you could do gentle compression like so. But to get into what we're talking about today, we're just going to do static pressure onto the wrist flexors. And we can do this between 8 and 30 seconds or even a minute. If we find an area that's really tender, that feels really tight, we can hold for longer. We can do the 8-second pressure just as a test to see what's sore along the way, and then end up with a little longer static pressure. So whichever hand you're using, the outside hand, the inside hand, you want to come to using the inside hand and applying static pressure, and you're going to move the joint into extension. So it's going to go from a neutral position to full extension as you apply pressure. And it's nice sometimes to come down into a kneeling position if you want to stand, and so you can apply a better angle here. That's an option too. So passive wrist extension, we should be feeling the wrist flexors underneath our fist or our palm. And now you're going to ask the client to do the motion, and you're going to show them what it is. Jenny, I want to have you move like this and like this, and you're going to move slowly and rhythmically like that, and then I'm going to apply pressure. Go ahead. So now the client is going to go ahead and do active motion with their wrist while I apply pressure to the muscles. And you can use a fist, and this is a pretty small area, so I'm using a fist, so I'm covering most of it. You also could use thumbs and work into specific parts as well. And as you apply pressure, you should feel the muscles moving underneath your fingertips, underneath your thumbs, underneath your fist. While you're applying pressure, it's difficult for them to extend their wrists, and that's normal. Okay, and relax. So we've performed static pressure. We've performed static pressure with passive motion, with active motion. Now we're going to go ahead and release pressure here, and we're going to bring the wrist into the area of a barrier. When we start to feel some resistance, we're going to stop. we're going to ask the client to resist against us with 10% of their strength. So you're going to push back this direction, Jenny, 10% of your strength, and go ahead. This hand is just resting here. So she's resisting back 10% of her strength. I'm at the barrier, and we wait for 8 seconds. And relax. When she relaxes, we hold the joint for 2 seconds. We don't move it at all. And then we very slowly move into the next barrier. So into more extension, and then have her resist again. Go ahead and resist. Relax. Good. Hold. 1, 2. A little more resistance moving into the barrier again. Have the client resist. Go ahead. And relax. Good. Hold. 1, 2. At this point, we can move through the range of motion and also do a stretch. So let's do a stretch. So we've moved all the way to the end here. We can do a little stretch for wrist extension and stretching the wrist flexors here. You want to make sure the elbow is straight and not bent, and then just give a little over pressure. So after we give a stretch, we're going to move back through the range of motion. This is great in the wrist. This is particularly important in the neck, where people can have pain if you don't move them through the range, and kind of reestablish a normal joint motion. And then we're going to retest. So we would take the arms up, and then we would see if we have an increased range of motion. So that is for limited extension, and we were working on the wrist flexors. If you don't see an increase in range of motion after you've done all this work on the muscles, it really indicates that the ligaments are tight and restricting the motion. And that is a different treatment and requires deep, slow stretching.